Hi everybody, welcome to Live Life for You. This is Vanessa back with you today to be doing a highly requested video. I've had several emails requesting this specific video. This is a video that I have been planning on doing from the start and just didn't know a good time to do it, but I can't think of a better time than now. I'm home alone and I don't have anybody to sit here and listen to me and bug me and stuff go on. You know how crazy life can get, so I thought I would jump on here and do this while I had a good time to do it. This video is going to be all about understanding depression, anxiety, and panic disorder. These are disorders that usually start in adolescent years between the ages of 15 and 19. I don't know if you guys know this, but I myself was diagnosed with panic disorder at the age of 15, so that time frame is actually correct. Panic disorder, anxiety, and depression appear more predominantly in women more than men. I don't know why that is. I guess women can just express their emotions more, express their feelings. They let stress get to them a lot more than men do, most men. I'm not counting everybody out because I do know a lot of males that have and live with this disorder every day of their life. What is depression? Depression is something that is onset biologically or from a traumatic event in your life, okay? If one of your parents has been diagnosed with depression, more than likely, unfortunately, you're going to have it too. Depression is the first stage of anxiety, generalized anxiety, and panic disorder. We all know what depression is. The vague description of depression is sadness, a darkness, not wanting to do much of anything. Normal activities don't excite you anymore. Nothing really impresses you or makes your tummy tingle anymore like it used to. I'm not going to go too much into depression because I know a lot of us already understand it and have coped with it. 99% of us that are watching this video right now are dealing and coping with depression themselves. So I will go ahead and skip on to generalized anxiety disorder. This is the second step. This stems from depression, underlying untreated depression, sometimes treated depression if you're not on enough medication or you're on the wrong medication, which in my case, I wasn't on any medication. Panic or anxiety disorder in adolescence can often be misconstrued by parents, mothers and fathers and caretakers as a cry for attention, as something that is fake and not real. So a lot of the times, more often than not, the parents will just tell them to relax, calm down, have a glass of milk and go to bed and live the next day. I don't know how to say to you guys, if your parents out there, if your child or anybody that you know that you love, your family, is suffering from anxiety disorder, do something about it now before it gets too bad. This is a highly treatable disease. This is something that can be not cured, but fixed, masked, so have you, with certain medications. Cognitive therapy, talking to a counselor, just getting something off of your chest can help this. What an anxiety attack is it is an overwhelming fear of impending doom. It is the actual heart racing, palms sweating, feeling out of body. It's not like a full-blown panic attack, but an anxiety attack. It's something that, the best way to describe it is when you're standing in line for a roller coaster at a theme park and you're kind of scared. It's the feeling that you get in your tummy. These can appear out of nowhere. Nothing has to trigger it. It can just happen. And that will be diagnosed as anxiety, generalized anxiety disorder. Now, if that's left untreated, you get to go on to panic disorder, and that is what I'm living with now. I have been for a very long time. I know that I have it. I'm on medications. I still have attacks. I've had over 1,300 attacks to date. It got so bad over the last year that I became agoraphobic. Couldn't leave my house. Couldn't do anything. I know that I'm telling you guys a lot, but I'm only doing this in hopes. The main reason I made this channel, in hopes to help somebody that might be going through the same thing and doesn't have a support line, doesn't have anybody that understands, doesn't have anybody to believe them, take them to the doctor. You have somebody now, because I tell you what, I wouldn't wish this upon my worst enemy. A panic attack is something that's kind of like an anxiety attack. for example, I have a panic attack almost every time I go into Walmart. Don't get me wrong, I love Walmart. I think Walmart's great. I love their stuff, so it's nothing against Walmart. It's a big area. There's a lot of people, and there's a feeling that I'm not going to be able to get out of the situation that I'm in. Like if I have a heart attack or if I should have a near-death experience, there won't be an easy way out. I feel like I'm locked in. I see all the fluorescent lights and my body just starts spinning. My heart starts racing. My jaw starts hurting. My chest starts pounding. I almost feel like I'm away from my body, looking at my body. It's an out-of-body experience. You can't breathe, your head's spinning, your ears will start ringing. You just want to grip onto that shopping cart or maybe hit yourself a couple times to remind yourself that you're still alive. You crave water and you crave out. You just want out. It's a horrible, horrible feeling. And I get it when I'm driving. My hands will start sweating and then I'll start spinning and I'll have to pull off the road and breathe. The biggest complications or setbacks that I've had with panic disorder is I always used to think I was having a heart attack. That's what you're going to think, because the symptoms of a panic attack are highly similar to those of a heart attack, and you can never know the difference. However, it is comforting when the doctor tells you in the emergency room that you're just having a panic attack and that you're fine. You've got an EKG run on you. Once you get that done about 2 or 3 times where you think you're having a heart attack and you go to the emergency room, your mind starts to think subconsciously that you know you're not having a heart attack. Mine have gotten better. I do take antidepressants, and I do take something in case of emergency situation where I do have a panic attack. I take something to kind of calm me down. I'm not going to reveal the name of it. Your doctor can help you and talk to you about what's best for you. But I do have them. I usually have about 1 a day. I know when I'm having them, I'll sit down. The only thing that I know to do is to get a tall glass of ice water, block breathe, which I'll do a ton of videos on this, you guys, for self-help, things that you can do to relieve your anxiety attacks or your panic attacks and perhaps prevent them from happening. You just have to know in the back of your mind that you're not going to die. Nobody has ever died from a panic attack. The worst thing that can happen is that you'll hyperventilate and you'll pass out, and then your body will start breathing on its own. I know that sounds bad, but that's the worst thing that can happen. You can't die of a panic attack. Know that and believe that and trust yourself that you're not going to. Okay? Try to avoid thinking about one so much before you go to a place. The only time that I really can think that I've worked myself up is when I know that I'm about to go somewhere that I've had one before. A lot of people tend to have anxiety attacks, panic attacks in places that they have before based on fear. Fear in the back of your mind that you know that going to that place equals pain and suffering. So, you know, by the time that you get to Walmart that you're already setting yourself up for one. So I'll do more videos and everything on how to try to convince yourself that you're not going to have one, that you're getting over this and it's fine. I will say one more time, if you are suffering from depression or anything like that, or feel like you have had an anxiety attack, you need to see your doctor. Your doctor will help you. They deal with this every day. There are millions upon millions of Americans suffering from this that are being treated. This is not a lost cause. This is not lost hope. This is something that hopefully you can live panic attack free. If I would have known what I've known for the last 5 years when I was 15, I would probably not be having them right now. It's the earlier you catch it, the better. So I hope that you guys have found this video informational and educational for you. If you have any questions about your personal life, you know, you can always email me. I'm here for you. I will be doing a lot of follow-up videos on this because there are a lot of remedies, techniques, therapies that you can do at home to help relieve or prevent an attack from happening in the future. And you know that I care about each and every one of you, and remember to live life for you.